Okay, welcome to Integrated Spine Pain and Wellness Pain Perspective. We are here with Dr. Ashu Goyal, and each week we are here to talk about different topics pertaining to chronic pain, regenerative medicine, and wellness. My name is Nikki Goyal, and I'm here to speak with Dr. Goyal and ask him questions regarding these topics. The topic that we're going to be discussing today is going to be DME, which stands for Durable Medical Equipment. So to start us off, Dr. Goyal, can you tell us exactly what is DME?
Sure. Okay, so DME stands for Durable Medical Equipment, and these are adjunctive modalities used in various specialties to help assist a patient in whatever ailment they may have. So specifically in pain management, we use DME in the form of back braces, knee braces, wrist braces, splints, and these sort of things can help assist a patient manage their pain, restore proper alignment, and improve overall functionality.
Okay, so as far as patients go, who is this going to help, and who is a candidate for DME? And how do you know when a patient comes in if you need to give them a back brace, a knee brace, etc.?
Great, yeah. So when I see patients with chronic back pain, for example, I'll see elderly patients who come in and tell me that they have trouble performing their activities of daily living, specifically cooking, cleaning, doing activities around the house, yard work. So once I evaluate them and I make a diagnosis, I can determine if a DME will be appropriate for them. For example, for patients with spinal stenosis, DME can allow proper alignment of the spine, take pressure off the discs and the nerves, and allow patients to be more active. So that's just one example. Patients with carpal tunnel syndrome, they can use wrist braces to keep their hand in an extended position, which can relieve pressure in the carpal tunnel.
Oh, wow.
So I've actually used one for myself and have found this to be very beneficial.
Now, is this something that they're going to have to wear for the rest of their life, or is this just, short term?
Well, that really depends on the patient and their specific situation. There are some cases where, for example, a patient has chronic lumbar spinal stenosis. Their pain may be intermittent and come and go, and DME is part of a comprehensive approach to managing the patient. So I may perform interventions. They may also be going to physical therapy. And if these modalities help the pain, then the back brace may not be necessary.
Okay.
So that's just one example. For other patients, I'll give you myself as an example. With my minor carpal tunnel issues, using the wrist brace has completely relieved that. I used it regularly for 6 weeks, and I've not had an issue since.
So just a very short time.
Yes, exactly. So it's a case-by-case basis, yeah.
Now, can the DME actually help somebody prevent prevent injuries from going further than what they are?
Possibly. So there's a condition in the spine which we call spondylolisthesis, where there's an abnormal alignment of the vertebrae. And so if there is something we call dynamic instability, where there's motion with flexion or extension, or in certain positions, that can compromise nerve roots. It can hit the nerves, cause pain. So a DME can actually stabilize that area. So we would do that in patients who aren't surgical candidates. Or people who are trying to avoid surgery if possible.
Is the durable medical equipment covered by insurance, or is this an out-of-pocket expense for patients?
Most are covered by insurances. So, for example, we also use TENS units. So many people are familiar with TENS units. That's a device that creates electrical current and stimulation to block pain signals. So those are typically covered by insurance. It just depends on the patient's plan.
Now, can you wear this brace or equipment when you are sleeping?
Ideally not, unless you are using perhaps a wrist brace. So that is when I used it, was at nighttime to keep my wrist extended. So, but a back brace, ideally not. We have cervical neck braces that are actually therapy collars that can train the cervical spine to go back into its normal alignment, or as normal as possible. So these are things you would want to wear during the daytime.
Okay.
Not at bedtime.
And do typically most patients wear these braces when they work out?
Typically not.
Okay.
So, when you're working out, you really want to engage the core muscles and the paraspinous muscles, which stabilize the spine. So, what I recommend patients do is do their physical therapy, do their workout, and then afterwards wear the back brace for maybe 15 minutes up to 45 minutes as needed.
Okay.
Yeah.
Now, are patients wearing these braces all day, every single day?
No, we don't want patients to do that
Okay.
for a number of reasons. So, actually, I take that back. It depends on the condition.
Okay.
For example, if a patient has a vertebral compression fracture, which is a fracture in the spine, if you think about having a fracture in any part of your body, normally you cast it
Right.
to allow the bone to fuse together and heal.
Okay.
In the spine, you really can't cast the body, right? There's no way to cast the spine. So, and the spine is a very dynamic structure, so it's constantly moving.
Okay.
The back brace in that situation is something you'd want to wear from the moment you wake up to the moment you go to bed,
Okay.
because that'll provide stability and promote healing of that fractured area.
Okay.
But with chronic conditions like spinal stenosis,
Yeah.
or chronic neck pain,
Yeah.
you don't want to become dependent upon the back braces.
Okay.
So you would use them only with prolonged standing, prolonged walking, or yard work, or household activities.
When
that
you need
increase-
that extra
Exactly.
support. Okay.
Right.
That makes sense. Okay. And then are these braces, are they custom fit for each individual? I mean, because obviously everybody kind of has different size necks and waists, and how does that work?
Sure, yeah. The back braces are mostly moldable, so we do customize those for each individual patient. Some of the wrist braces, the knee braces, they are one size fits all, but they can be adjusted.
Okay.
So we typically at the office, if a patient is a candidate for DME, we'll have them try it on and see if it's something that will conform to their anatomy. There are,
Okay.
like you said, there are people with short necks, and
Right.
unfortunately, most of the therapy collars that we have available to us are one size fits all. So
Okay.
yeah, or most.
Yeah.
Yeah.
Wow, that's great. It's really interesting to learn about, other things that can help, support patients that are, have nothing to do with medication or procedures, just things that you can do at home to really help, ease that pain and discomfort. So
Absolutely.
it's great.
Yeah, it's about a comprehensive approach.
Okay.
Offer patients as many modalities as we can that are safe and effective.
I like that. And it's something that, they can have long term. So if they need it, it's always there for them.
Exactly.
And that was another question I was going to ask you. Basically, once they receive a brace, is this something that they can have for, the rest of their lives? Or is this something that they want to, get a new brace every year or every couple of years? How does that work?
Well, like anything in medicine, there are constant innovations that are occurring. So even in the world of bracing, so I've seen a wide variety of braces that are available, and I feel like the newer ones are just continue to get more comfortable, more
Okay.
supportive. So depending on the patient's insurance plan, they can be replaced from every 1 year to every 5 years.
Oh, okay. Oh, good to know.
And there's always a cash pay option too for
Okay.
some of this equipment.
Okay, wonderful. Well, if anybody has watched this segment and is interested in learning more about DME or durable medical equipment, you can reach out to Dr. Goyle. Our website is www.ispwscottsdale.com. There's a lot of great information on there. You can also call our front office, and they can give you the information you need as well. So, Dr. Goyle, thank you for answering
Thank you, Nikki.
my questions today, and we look forward to future segments. Stay tuned for our next one. Thank you.
Thank you.